going to see my people? When are we going to do the screening? And in my mind, I'm like, she came for her own. Pastor came for his own, and they are talking about you. I mean, that goes to tell you how much they love you. There's almost no visits where Pastor and Mommy will not bring up the issue of when are we. If you know how we've been talking about what we are doing today, we started talking about it more than a year ago. And I'm happy that today it has come to fruition. I want us to appreciate Pastor, Mommy, and everybody in the medical team. They really, really love you. I'm serious about that. I've never told Mommy this, but I'm usually so touched when she brings up this issue. So again, we have this opportunity, and I think it's a very big privilege. So the Bible talks about my people perishing for lack of knowledge. You see, when I went in there, my colleague who will be running the ECGs, I was asking him, how did you locate this place? Was it difficult? He said, how could it have been difficult when we have Google? So it was many years ago you would have difficulty finding a place, not now where there is Google. And that's exactly what happens to health issues today. Many years ago, we didn't have information. So now that there is wealth of knowledge and information at our disposal, there is no excuse. There is absolutely no excuse. God will not do for us knows we can easily do for ourselves. And that's why God has released this wealth of knowledge. Have you not wondered how people, you think it is ordinary for someone to just sit down and then just discover an aeroplane or no, it's inspiration of God that comes upon man. And even in the field of medicine, God has evidently showed us mercy by telling us, giving us knowledge and information. And I want us to tap into this and take this issue seriously. Many years ago, our greatest fear about health was HIV, malaria, infections, and all of that. But surprisingly, everything has changed. Now we talk about non-communicable diseases. And non-communicable diseases include things like hypertension, diabetes, from the way the name goes, non-communicable. So it is an illness that you can get without, communicable diseases are the things you touch someone, you inhale it, and things you acquire from close contact. But non-communicable diseases are diseases that we can have from, not related in any way to having contact or meeting with people. And the statistics is very frightening now. In about 2002, and even after 2002, WHO and the health body released statistics regarding the number of deaths per disease condition. And people shivered when they saw that cardiovascular disease stood out as the number one cause of death in the world. You would have thought that HIV, infection, and all that would be number one. But that was not the case. Then what was even more frightening was that the number of deaths from cardiovascular disease was 2 times higher than...
Doctor, what is does cardiovascular
So I'm going to come disease to that now. So the number of deaths from cardiovascular disease was double the number of deaths that came from the second highest. The second highest was cancer. The number one was cardiovascular disease. Then the second was cancer. So cardiovascular disease had like 20 million. Let me just use that word. Cancer had like 10. So, and I know that if I talk to you about hypertension and I talk to you about breast cancer or cervical cancer, people will get more scared when we enter the cancer issue than when we talk about hypertension, isn't it? But statistics over the years have consistently shown that we had significantly more deaths from cardiovascular disease than from cancer. And we thought that this was Oyibo man's statistics and that we were not part of these statistics until we began to look at our own statistics in this part of the world. And it was shocking that the same statistics that was abroad was what we were seeing here. Cardiovascular disease from Lutz, when they looked at post-mortem results after deaths, when they did autopsy to find out the cause of death, almost half of the number of people who died had cardiovascular causes. When UNTH looked at their own, it still came as the same. So we began to see that the records were similar between us and Caucasians. So, and that called for an urgent step for us to be proactive. Now, when we talk about cardiovascular disease, what do we really mean? From the way the name goes, cardio and vascular. Cardio means heart. Vascular means blood vessel. So if you put the two together, it means heart and blood vessel. So when we say cardiovascular disease, we mean diseases that originate from the heart and blood vessel. And the number one cause, the commonest cause of cardiovascular disease today all over the world is hypertension. So hypertension has stood out as the number one cause of cardiovascular disease. And so when you talk about cardiovascular disease, it means heart disease, blood vessel disease, and all the other complements that come with it. Now, if you talk about hypertension, diabetes, high cholesterol over and over again, you can never get to a point where people will say you have talked about them too much because they are even moving faster than we are talking about them. They are moving very rapidly. So I see people, they'll tell me, no, how can you tell me I have hypertension? I'm just 22 years old. My father had his own when he was 70. And I don't blame them because the truth is that that was the pattern previously. When you talk about heart attack, you ordinarily should not expect 40 to be having heart attack. But we are seeing different things now. High cholesterol, blood sugar problems. You just see a 22-year-old with very high blood sugar and you'll be wondering, blood pressure is even, I don't even know how to describe that. And these are all the small entities that sum up and come together to cause cardiovascular disease. So hypertension is the commonest cause of cardiovascular disease. Diabetes causes cardiovascular disease. High cholesterol causes cardiovascular disease. Obesity causes cardiovascular disease. Smoking, alcohol, excess alcohol ingestion, all of these are responsible for cardiovascular disease that has stood out as the number one cause of death all over the world, causing twice more deaths than the cancer that we dread so much. So we say they are small but mighty because of the impact on our health system. So even for the high blood pressure, we have not even been able, the statistics have shown that for those who have high blood pressure, only 1/3 of people even know their blood pressure status. Then among the 1/3 that know their blood pressure status, only 1/3 are on medication. Then among the 1/3 that are on medication, only 1/3 are well controlled. Can you see the trend and the disaster? And this is the number one cause of death. So I want to really, really, really thank the team, Pastor and Mommy, for putting this program together. You know, I've watched some men of God and I've learned from them. I've been privileged to manage some very senior daddies in the ministry. I'm talking about managing overseers of some ministries. I don't want to mention the names, bishops. And there was something I observed about some of them. I remember one bishop who would come to me. I always knew his date. His date was September. And he would just come to me. He would say, Dr. Kobe, I have come. I say, good morning, sir. He would sit down, say, I have come for my checkup. So you would think that he would have, I have this, I have that. And when you ask him, please, sir, what are your complaints? I don't have complaints. I just came for my checkup. Sir, you mean you don't, no headache? I don't have anything. But I just came for my checkup. And then we will do and go and pick all the investigations, kidney function, liver function. You know, what can you do for yourself? You work so hard. Why not gift yourself with just this? Some 2 years ago, I met a 53-year-old man, very cute, handsome, well-dressed. I knew he had money because I could see his skin texture. I saw his dressing, so I knew that this man had money. And then he walked up to me and gave me a packet of tests. And he told me, doctor, yesterday was my birthday, and I decided that I was going to do it differently. He said to me that before, I would hang out with my friends, we would eat nkwobi, pepper soup, and drink and all of that. But something just told me to have a different program this time around. And I thought that the money I would spend for those celebrations of my birthday, I would invest it on a check. I have never done this before. So I went in for this test. So he gave me the results. So when I opened the test, I saw, it's like saying a dead man who was alive. So when I looked at his heart test, I could not believe it was the man that was sitting there that had the results. His heart was very bad. So, and this is the pattern. Some years ago, a young, vibrant man, money was coming, went to somewhere in Lekki or VI to hang out with friends, and they were doing some sports, and he collapsed on the, okay, sorry, thank you. And he collapsed. So he collapsed on the tennis court. So his very close friend who was with him on the tennis court was confused about what could have happened to his friend, because for all the time they had known each other, he never had a complaint. So when he collapsed, he died, and there was no rescue for him. So this gentleman ran to a hospital where I was, and he said to me, he said, doctor, I want you to check everything. I said, what do you mean check everything? He said, everything. So we began to check everything. So when I put the heart probe on his chest to look at his heart muscle was as big as my hand. So I turned to him and I asked him, do you have a heart condition? He said, no. Are you hypertensive? He said, no. I said, so why did you come for this? So he told me he just wanted to do a comprehensive because his friend died a day before. So after doing the test, I checked his blood pressure. His blood pressure was in the sky. So what that meant was he probably would have died like his friend if he did not discover this at that time. So the death of his friend caused fear. that drove him to the hospital. And while we were doing that, he had issues. And that was the beginning of his journey. So I feel that God has given us wisdom, and wisdom is profitable to direct. There is no excuse with the wealth of knowledge. Even those who are discovering, who yet don't believe in God, it is still God that inspires them. There are many discoveries, and we have them now. I mean, it will be very painful to see that after all the church has put together, that people are not tapping into it. It is not something you are to do every month. It is a decision you need to take for yourself to follow through after now. I think this should be like the second or third edition. Third. So we should be motivated. Mommy and pastor, they're always talking about you when they come. Dr. Kobe, when are we going to do this? Will you be available in March? So, and that is from how much love they have, because they desire exactly what 3 John verse 2 talked about. That, beloved, I desire above all things that you prosper in health, even as your soul prospered. So everything is not spiritual, even though everything is spiritual. But what I'm trying to say is that there's still a part of it that God expects us to use the wisdom he has given to us to work out. And that's why John was saying, I wish above all things that not just the way your soul is prospering alone. It's a good thing that your soul, your spirit is prospering, but I also want you to prosper in health. And that is what we are doing today. So I want us to please just give a very sounding to pastor, to mommy, to the medical team for working out all this. Now, finally, there is hope. To him that is joined to the living, there is hope. So, no matter what the problem is, there is hope. This is the starting point. Then you can take it from here. There's no need to be afraid. It is a discovery. There was a time I was talking to Prof. Ebele, and she said something some years ago, and it has stuck. So we're talking about, dreams and all that. And she said, dreams are revelation for revelation for prevention. God shows you some things so you can prevent. And that is what medical checkup is all about. I have already put it on the table. This is what the world is saying. We didn't believe them before. But looking at our statistics, it looks like that is what we have. It's cardiovascular disease. And these conditions don't give sign. They don't give symptom. They don't. You don't feel anything, and yet they are there. So the least we can do for ourselves is to check them out, so that if there are issues, by the grace of God, we can sort them out. Because we are special beings, we are joined to him. Our own will be different. Because once God's hand is upon you, there is no issue again. Just do your own part. That's what God wants us to do. Sometimes I feel that doctors have very big problems, because I just imagine that on the judgment day, God will say, Dr. Okobi, I brought this man to you. What did you do? I mean, God has given us that responsibility. How have you handled it? God called you to something. God is giving you the knowledge. God is using people to direct you in the right direction. How have you tapped into this opportunity? So, in summary, today we will be looking at some of our parameters. It's not a time to fear. It's not a program to cause anxiety. There's no anxiety. If there's anything, we sort it out. Simple. If there's nothing, we will be encouraged to continue that lifestyle that has made our results to be clean. So let's tap into it. Whether hypertension or diabetes or high cholesterol, there is solution. I want us to be motivated and make up our mind to make the best use of this opportunity. Thank you very much.
Praise the Lord. Thank you so much, Dr. Okobi. So do we have anybody with any questions? Any questions you want to ask?
Any questions? Okay.
No, he has a mic.
Okay.
Thank you, Dr. Okobi. My question is, when you have this kind of electric tingling on your hand, I on my own, it's my left hand that I feel it. You know, it has this, I don't know, it just feels like, I'm not an electrician, but you know, it feels kind of electrical. It just, it feels uncomfortable. It runs from the arm down to my fingers. You know, is it a sign of something wrong somewhere in the heart?
So I think, okay, can I take that question? Okay, so yeah, you described it well, sir. It's actually like an electricity, and even medically we call it electric shock-like sensation. So when you have electric shock-like sensation, it's usually nerve related. So as human beings, we are entities that are connected and supplied by wires, but we don't use the word wires because we are human beings. On your heart, before your heart will contract, electric currents would have to go through the muscles, activate the muscles before the muscles will begin to contract. So there must be a conduction of electricity to the heart muscles before your heart begins to contract. So also the brain and the spinal cord have wires that originate from either the brain or the spinal cord and permeate different parts of our body. These are wires through which messages are sent to the muscles and to the skin. And there's also a returning wire that takes our responses, back to us. So the wires that bring our responses. So what you just described now looks like nerve irritation that comes from the neck. So the bundle of nerves that supply our hands emanate from the neck and then flow down your shoulder to the fingers. So if something irritates the nerve at the level of your neck, it will give you electric shock-like sensation. For some people, it is a numbness. For some people, it is a tingling. For some people, it's peppery or burning sensation. So whichever one you feel, they all are pointers to nerve irritation. And that is not an indicator for stroke. Stroke usually would come with one half of the body either paralyzed or having abnormal sensations like what you have described. One half of the face, your hand, your trunk, and your leg. So just one half. So, but from your shoulder down to the hand is nerve irritation and it's coming from your neck. So not an indicator for stroke.
Okay. So at what age should parents start checking blood pressures for their children, given that the age for hypertension is dropping?
Okay. Good question, because, some years ago, I would have said maybe from 35 years. But now, I would say once your children each reach age of adulthood, which is 18, begin to check, especially if there is a strong family history. So 90% of people who have high blood pressure have the type that is genetically inherited. That's what we call hereditary hypertension, unknown hypertension that is called primary hypertension. Now, every offspring is a makeup of genetic contribution from mother and dad. So if the father and the mom has high blood pressure, it means they have a gene that codes for hypertension, and this has been passed to the offspring because the chromosomes in us are contribution half from mother, half from father. So coming from a hypertensive home already predisposes you to having hypertension. But there's also the part where this genetic predisposition has to interact with environmental factors to make this hypertension truly become established. So the fact that you are genetically predisposed does not mean you must have hypertension. It is when you are now not careful with your genetic predisposition, you are not looking at your environmental factors, you are consuming a lot of salt, you are eating a lot of seasonings, you are growing big, you are not exercising, you are doing sedentary lifestyle. So these are all environmental factors that encourage that genetic predisposition to become established in you. So we are seeing 16-year-old with high blood pressure, 17-year-old, 20-year-old, and it's very common now. So I would advocate from 18 years onwards. Okay.
Thank you, sir. Please, can a pregnant woman also do ECG?
Yes, ma'am. A pregnant woman can do ECG. It's not radioactive. There's no radiation. It's just an ultrasound, an electrical, what's it called, like an ultrasound. Not exactly an ultrasound, though, but there's no radiation involved. Okay.
Thank you, doctor.
Yes, mommy.
I used to have that tingling
Okay,
on
ma'am.
my ear
Yes, ma'am.
every morning or sometimes in the afternoon.
Okay, ma'am.
I see something making noise, but at first when I notice it, when I hear it, I look back, but I don't know it was coming from my ear.
Okay. So mommy said tingling. So I don't know if it's real tingling or if it's a noise in the ear.
It does like a shock.
Okay. So if it's a tingling sensation or like a shock, it is still nerve irritation and it's coming from the neck because your upper parts down to this place have nerve supplying it from your neck. So it is still likely to be from the neck and it is nerve irritation, and there are some medications we use for that.
Okay, so when
Okay.
you're on antihypertensives, are you on them for life?
Okay, so very good question. Because, again, we've had big problems with some of our patients who started antihypertensive and then stopped. Now, I think the problem is two-way. One, the doctors didn't communicate properly to the patient. And then two, the patient sometimes refused to accept the reality. So let me look at the part of the doctors didn't communicate well. So the doctor saw a patient, did the right thing, prescribed medication, and somehow just presumed that the patient will know that the medication should continue. And because you have not interfaced properly with the patient doesn't understand what you have done. And that's why I say, how can you see a doctor without knowing what is wrong with you? You deserve to know. You pay the consultation fee to see the doctor. So you can carefully listen and then ask the doctor, so doctor, what is wrong with me? What is my condition? So some people don't really ask. And sometimes because doctors are overworked, they just give you prescription. So some people start medications and then after a while they stop. Now, 90% of people who have high blood pressure will need their medications for the rest of their life. Only 5 to 10% may go off their medication. And it is the doctors that can guide you to tell you if you fall in the category of those who at some point in the journey of treatment will not require medications anymore. But it is important to know that 90, which is almost everybody, will require medications for the rest of their life. Sometimes in the journey of treatment, the doctor can drop your drugs. Sometimes he may need to increase. Sometimes he may need to change. But by and large, for most of the people, they will need the drug for the rest of their life. Okay, ma'am.
No, John.
Okay, can talk.
No, somebody is
Okay,
asking.
she wants to ask. Okay.
Okay, thank you, Doc. Sometimes I feel a sudden palpitation, like a very fast heart rate beating. It happens, it doesn't give any warning, then I get a bit lightheaded. It's as if if I'm driving, I would have to park. When I saw a doctor, he was saying something about panic attack, but there was no medication whatsoever, and it keeps reoccurring.
Okay, thank you. That's a very significant symptom. So your heart beats at a particular, within a range. What is accepted as the normal range for heartbeat is 60 to 100. But for some reasons, in certain people, the heartbeat can race. So you would just see, boop, 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 boop. And if you check your heartbeat at that time, it may be 150. So some will have a heartbeat of 200, which is very abnormal. So if your heart is racing more than normal, it is not normal. Certain things can cause it. However, in women, especially women in their second and third, and maybe fourth decade of life, sometimes they have this experience. We call it paroxysmal atrial tachycardia. The heart just boop, 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 and then it will just stop on its own. But if your heart beats like that, and while your heart is beating, you passed out, or while your heart was beating, you started sweating profusely, or while your heart was beating, you developed a chest pain, or while your heart was beating, you became lightheaded, or became symptom, and it must be investigated. Some more. So I'd like to see you in the course of the treatment. Okay.
Dr. Kubi.
Yes, ma'am.
I am on BP.
Ma'am.
Because you are my doctor.
Yes, ma'am.
And mine started from, that's 18 years ago. That's when I was pregnant. It was pregnancy induced.
Okay.
And I've been on medication. But sometimes I would just, because you told me to always check, though I'm on medication, I should always check, and you've been changing my dosage and all that. Sometimes, like I think some few days ago, because I try to check at least twice, every 2 days. I checked and I saw my BP had dropped. It was low. It was normal, sorry, not low. And I had not taken my medication. So for that day, by my own consultation, I did not take. And the next morning, I checked. It had gone up, so I took. Was I wrong in doing that?
Okay, very good question, because again, this is the confusion we have about care. So some patients get scared that, why should they still take their drug when the blood pressure is normal? So if their blood pressures are normal, by taking the drug, won't it drop some more? So now, what I would say to that is this. One, most blood pressure drugs have a half-life. They have the duration for which they work within the body. Only few of them cover a proper 24-hour duration. So when you say 24-hour duration, it means if you take the medication 9 a.m., the effect of the drug will continue till 9 a.m. of the following day. But a large number of the blood pressure drugs don't do 24-hour coverage. Some have 14 hours, some have 18 hours. So if the longest is 24 hours, it means that by the following day, 9 a.m., if you took it 9 a.m. the previous day, that one you took a day before would have expired in the body. When you take the drug, as your body absorbs it, the amount of blood getting into the bloodstream will gradually peak. And there's a particular period where it reaches, the concentration of the drug reaches the highest peak in your bloodstream. Once it has hit that peak, the next thing that follows is it will start dropping. So it will start dropping gradually until it disappears from your body. If you measured your blood pressure and it was low, then you would be right not to take your medication. If it was normal, you should still take your medication. However, if you noticed that it was too tight, okay, let me explain. Normal blood pressure, 90/60 is normal. But most people feel that if your blood pressure is 90/60, it is low. It is normal. 100/60 is normal. 130/80 is normal. We used to pride ourselves in the past by saying, oh, but now there's nothing like that. 130/82 is normal. But the books from all the studies they are doing found out that the complications and the effect of high blood pressure on the organs seem to continue even when your blood pressure is high normal. So it means that even at 130/84, which is normal, the effect of high blood pressure on your organs still continues. So now, everybody is confused. You have told us that normal is when the upper one is below 140 and when the lower one is below 90. And you have clearly in the definition of hypertension said hypertension is 140/90 and above. And now, you are now telling us that even at 130/80, the effect of high blood pressure on the organs still continues. And what they are now recommending is that try and get your blood pressure to be less than 120/80. But I think they are scared to come and change the definition. Because if you are saying it is only below 120/80 that the effect of hypertension is not pronounced on your organs, then it means you should come out boldly to say the normal blood pressure should be less than 120/80. But there seem to be some around that area. They know, they've just found out that, okay, so they are now saying, please, let your blood pressure be optimum. And optimum means when you get readings below 120/80. For some people, 120/80 is, anything below 120/80 is low. I've met people who were referred to me because they said their blood pressures were low. And when I asked what the blood pressure was, they said it was 110/70. And I said, how can you say 110/70 is low? So for them, it is low. But what the guideline is currently recommending is try to get your blood pressure at optimum reading. And optimum means below 120/80. The Americans have already started. You know, they are very proactive. If you get a blood pressure of 128/80 in America, they will not tell you your BP is normal. They will tell you you are pre-hypertensive, because labeling you as pre-hypertensive has a way of motivating you to be proactive. But if you say, 128 is normal now, you have the tendency to go and relax. But if you are getting 128/80 and they are telling you you are pre-hypertensive, pre-what? Pre-hypertensive. So you want to begin to work on it. Let me cut down salt. I don't want to ever reach the level of hypertension now that I am pre-hypertensive. So that's what the Americans have done. So for me, even now, when I have in 130/80, because of what the guideline now talks about, I try to get their blood pressures even lower. But if you start getting 90/60, 90-something, 70, which are all normal readings, you agree with me that that seems to be tending towards low. So if you get readings like that consistently, then it might just be time for you to reduce the dose of your medication a bit. So the reason your BP went up was because you had a normal blood pressure. You should have taken your medication, but you skipped it. So by the following day, it spiked again. So you should take it next time once the reading is normal.
Thank you, Dr.
Yes, ma'am. Thank you, ma'am.
Please, I normally have a...
Okay.
It's not... I normally have numbness on my right leg.
Okay, ma'am.
Numbness on her.
My right leg.
Okay, ma'am.
And it has been off and on.
Okay, ma'am. So numbness still means irritation of the nerve. But for certain people, I may also think of something else. So there are two things that can cause numbness on your legs. One, when there's reduced blood flow to your leg, it can come as numbness. Or when something is irritating your nerve. So if an 80-year-old tells me I feel numb on my legs, I will not put it, I won't categorize it as nerve irritation only because of age. Because as you get older, the arteries that supply your leg get narrower. And as they get narrower, blood flow to the leg reduces. And when there's a significant reduction, you begin to feel numb. So for elderly people, we should also consider that possibility that is either something is irritating the nerve or there is reduced blood flow to the leg. But for a young or a middle age, I would probably think is nerve irritation. Now, the nerves that supply your leg come from your low back because the spinal cord runs down the middle of the back. So, and they branch off and give branches. The spinal cord gives branches. The branch that runs from the spinal leg is likely being irritated at the level of the back. So I feel that yours will probably be nerve irritation from your back, especially if you have been having low back pain. Yes, so probably it's nerve irritation from the back, ma'am. Yes, ma'am.
Good morning.
Good morning, sir.
Good afternoon, Dr.
Good afternoon, sir.
I have a couple of questions.
Okay, sir. Yes, sir.
Yes.
Yes, sir.
First, I'm about 70-year-old.
Okay.
What would be a standard
Blood
BP
pressure reading.
1. 2, when is the best time to take the BP reading? Is it before your drugs in the morning or after your drugs in the morning? And if it's after, how many hours after? Thank you.
Thank you, sir. So, so let me take the first one. In 1934, if you had a blood pressure of 200 over 100, you will not be given medication. Because at that time, blood pressure was considered to be a compensatory mechanism. And there was a saying that anybody who tried to reduce a compensatory effect would have an adverse effect. So what they'll probably tell you to do at that test, take Lexotan or something like that. Then later, as knowledge began to unfold, we began to say that, this is foolishness, so why will you not treat 200 over 100? So you can imagine, even in the textbook of hearts, in 1934, they will not treat you with a 200 over 100. Now, when I was in medical school, in my clinical years, our textbook then talked about people who were 70 years and above, and they said if they had 160 over 90, it was okay. Then from there, it shifted to no, 160 over 90 is high for everybody, no matter your age. It came down to 140/90. And even now, Americans are saying 130/80. And like what I just told you now, just that they have not come out officially, but they are like, look, the only time you are sure that this BP is not having effect on your organ is when your reading is below 120/80. So you can see how it has shifted from a point of 200/100 to now. We are even saying you should not be satisfied with 130/80. You are encouraged to get your blood pressure to be optimum. So the issue of blood pressure age has long died. We don't talk about it again. And we have put the same figure for everyone. So your blood pressure should be less than 140/90. Even if you are 80 years old, even if you are 90 years old, the target is it should be less than 140/90. There are some persons who have claimed that if their blood pressure drops to 170, they begin to feel dizzy. So, and if it is really, really true that that is what happens to them, then you would probably want their blood pressure readings to be higher than 110/70. So in a way, there's still a part of this discussion that you may need to individualize. So if you see that, oh, this person feels dizzy at 110/70, you better allow his blood pressure to come up a bit. But if the person feels comfortable with 110/70, encourage the person to hit that target. So that's the first question. Then the second question is, when do I check my blood pressure? So there's a little complexity to it, because truly, we all have our blood pressure patterns. It's just that we don't know them. Ideally, if you were going to have a thorough blood pressure evaluation, you should do what we call a 24-hour blood pressure monitoring. The reason is because some people spike blood pressure in the night when they are sleeping. And unfortunately, that is when all the bad cardiovascular events occur. Look at most people who have had stroke. When did they have stroke? They slept, they wanted to go and urinate, and they couldn't get up from the bed. Early hours of the morning. A lot of my patients who had heart attack, it happened early hours of the morning. So many of these events occurs in the early hours of the morning, probably because of what we call the cortisol effects. So the way God made us as human beings, in the early hours of the morning, there is a hormone called cortisol that is released into circulation. So this cortisol increases your blood pressure a bit. So if your blood pressure was already high, then in that morning, body releases cortisol. It means that the blood pressure will go even higher. And that explains why a lot of these events occur in the early hours of the morning. So if we had the privilege of doing a 24-hour blood pressure monitoring, what usually would happen is that you will wear the blood pressure kit and go home. And you will wear it for 24 hours. During the day, it will measure your blood pressure every 20 minutes and record it. In the night, it will measure your blood pressure every 30 minutes and record it. At the end of a 24-hour period, it will now give you all your blood pressure readings. Highest reading in the night, lowest reading, highest reading during the day, lowest reading. Then it will now give you the average of your blood pressure for that 24-hour period. Now, from this test, what we have discovered is some people run normal blood pressure during the day. Then in the night, you'll be seeing 170, 120, 170, 110, 180, 120, while they are sleeping. Then in the morning, 9 a.m., blood pressure will just be 140, 90, 130, 80. So you would think that they are okay. So some spike in the early hours, during the day, their blood pressures are fine. Some spike during the day, and in the early hours, their blood pressures are normal. So it depends on your blood pressure pattern. But because everybody cannot do a 24-hour blood pressure monitoring, we would say that you can check your blood pressure before you start activities. So either at bedtime when you're about to go to bed, or when you've just woken up in the morning before you get into your daily routines, you check your blood pressure. If you see that you have noticed a pattern that is confusing, then you can even decide to check it in the morning and evening and show your doctor. Then your doctor will be able to guide you. If I've answered your question, sir. Yes, sir. Thank you.
Okay. Good afternoon, sir. Good afternoon, doctor. I'm the one talking.
Okay. Thank you.
Okay. My pattern lately. I noticed that when I check my blood pressure, the lower part, that's the diastolic now, is usually always at 90 or a little bit above 90. But the systolic is usually below 130, maybe 122, 128. But I've been noticing that pattern lately. It's usually high, almost every time I check my blood pressure.
So she's right. So your blood pressure has two components, the upper part, which we call systolic, and the lower part, which we call diastolic. For you to have a normal blood pressure reading, both must be normal. That means your systolic has to be below 140, your diastolic has to be below 90. If either is high, that is, and that's why they have given us a figure, a cutoff, that 140/90. So even when your upper reading is fine, systolic is normal. If you are consistently getting your lower reading as 90 or more, that is still hypertension. Not everybody who has high blood pressure needs to start medications immediately. So when you are once you notice a pattern that my blood pressure seems to be going up recently, you are expected, one, to see a doctor. So the doctor will help to, first of all, establish. If you look at the definition of hypertension, the book says sustained elevation, not a one-off reading, because I don't think there's anybody here who has not had elevated blood pressure at once. But it does not mean we are. Do you understand? Because certain activities can increase your blood pressure. Exercise, you run up the stairs, you come down, you check your BP, it will be high, but that does not mean you are hypertensive. So in the definition, they had to specify that this elevation has to be sustained. So you've watched the pattern and it is high. So that's one. Then, so once you have established that the elevation is sustained, then the next thing is for the doctor to see if you are showing symptoms of sign of organ damage. So the doctors will ask you some questions. So if the questions show that there are no symptoms of organ damage, the doctor will examine you and perhaps send you to do some tests. So if everything still comes out fine, you don't have symptoms to suggest organ damage, your physical examination was normal, your tests were normal. For that kind of blood pressure, the doctor won't give you medication. So when your blood pressure is mildly elevated and you don't have symptoms of organ damage and your examination finding and test results come out normal, and you also don't have diabetes, you are not meant to start medications. You are supposed to do lifestyle, and WHO has put the duration 3 to 6 months, and those lifestyle measures will should help to bring down your blood pressure. So what are the lifestyle measures? Exercise. If you are overweight or obese, you lose weight, you cut down on salt, you stop smoking. Before, we would allow you take little alcohol in the past by the guideline, But now the guideline is saying no. So no alcohol, stop smoking, cut down salt intake, do exercise, lose weight, and take meals that are rich in potassium, fruits and vegetables that are rich in potassium. So these are the 6 lifestyle measures that will help to bring down your blood pressure. So by the expiration of the 6 months of lifestyle, if the blood pressure still remains high, then you would start medication. But if you have mildly elevated blood pressure and you already have diabetes, there is no opportunity for lifestyle. You start medications immediately. If you have mildly pressure and either your examination finding or test results confirm organ involvement, there is no opportunity for lifestyle only. You have to start medication and combine medication with lifestyle. Then for those who have moderately elevated blood pressure or severely elevated blood pressure, you start medications immediately. So the only group of people who will have elevated blood pressure and have the opportunity to do lifestyle alone without medication are those who have mildly elevated blood pressure, they don't have diabetes, they don't have any abnormality on physical examination, and all their test results have. Those are the only people who will have the opportunity to do lifestyle measures only for 3 to 6 months, after which the doctor will decide on starting or not to start. I don't know if I've answered your question. Okay.
Okay, thank you very much, Doctor.
Okay, thank you.
It's been an enlightening session.
Okay.
With the explanation to when Pastor Ekuzi asked the question, is there a preferred time that one should take the hypertension medication? Is it morning or in the evening? Okay, thank you. So the best time to take your medication is when your medication. So some people think that they should have their medications in the morning because of all the activities that occurs during the day. Struggled many times to keep to taking medications in the morning, and they will always fail. They wake up early, they forget the drug. Sometimes they put the drug in the car. The sun consistently hits the medication and denatures it. Medications are supposed to be kept in cool places, not in the car where the sun is getting to it. So all in the attempt to, let me take the medication. So if you struggle and you're always forgetting to take your medication in the morning, why not take it in the night after dinner when you are going to bed? So there's really no specific time. And what we say is, if you are on a once-a-day medication, choose the time that you know you will not forget. Thankfully, most of the medications are made to cover a 24-hour period. So if you take it 9 a.m., it will work till the day. If you take it 9 p.m., it will work following day, meaning that it will still cover you during the day. So let it be the time that you know you will not forget. Any other? Okay, am I done? Okay.
That's all, so that we can start. The time has gone. We need to start
the screening.
The screening, please. How many people agree with that? So if you have any further question, just ask Dr. Inside personally, please. Because me, my own is not hypertension. It's what? My own is low blood. So that's another problem. And I don't think anybody has low blood problem. So I'm the only one that has low blood. Huh? They have not checked. So, doctor, we can go in now, right?
Okay, thank you.
Thank you. Please give a clap offering to doctor. You can stretch forth your hand and bless him. Bless him before he leaves. Bless him before he leaves. That the Lord will uphold him. God will continually strengthen him to do this work. God will take care of his family and his children. What is helping us to come to, he will not get into that line of sickness. We seal you in the blood of our Lord Jesus Christ. Bless your children and bless your families. In Jesus' name we have prayed. Amen. Doctor, you can go in. So admin, Kenny, somebody needs to stay by the door. By the door, yes. Priority, yeah. Please, Mama is first. After Mama, the pastors.